The treatment of lung cancer has changed drastically over the past decade. The biggest difference is we're able to catch it earlier when it's at a curable stage.
We're impacting the #1 cancer killer globally in a way where we're taking a disease that was virtually incurable to making it highly curable.
Every year, we have multiple new drug approvals for people with lung cancer. I am so encouraged to practice in a setting where I can offer people novel treatments to improve their quality of life and to help them live longer.
The treatments that we're doing today are much more accurate than what we did in the past because we're able to visualize the tumor right before we do the treatments.
Academic hospitals such as Mount Sinai are the ones that are making the new discoveries, and we are making the discoveries that are leading to the next generation of medicine.
I saw an opportunity to build up a center at Mount Sinai, a comprehensive thoracic oncology center. That was my goal. And over 6 years, I think we have come far away to achieve that goal.
Each year, you want to improve the lung scan to give more and more information.
About 20 years ago, we started discovering that more and more people were actually developing lung cancer even though they never smoked. And as we're seeing now, data is showing that we can adequately screen never smokers and provide increased cure rate.
Integrating new technology together with the CT scanners that we have and then taking it to the next step. We think that since we're scanning the entire chest, we really think it's a health check because we find, for example, coronary artery calcifications in the heart. We also see emphysema in the lungs.
We are catching these cancers at stage 1s where they are very curable. 80% of those cancers that you catch at stage 1 will be cured. That wasn't always the case.
We keep exploring new things that people haven't thought of.
Liquid biopsy, which means blood-based analysis of cancer abnormalities, is very promising in the diagnosis of lung cancer.
We can take a few tubes of blood, and instead of doing a biopsy of the tumor, we can use the blood to actually look for evidence of the cancer in a patient's blood. And we can tell if a patient might be a candidate for an oral therapy versus immunotherapies, and it also tells us whether or not a patient might be a candidate for a clinical trial.
Why is it important for me as a surgeon to catch these cancers earlier? The reason is because when you catch it earlier, you can do the surgery with 3 little small holes in your chest. It's called minimally invasive thoracic surgery, or VATS, video-assisted thoracoscopic surgery. And with those 3 holes, you can cut out the cancer.
Thanks to clinical trials, the treatment of non-small cell lung cancer and all types of lung cancer has really radically changed in the last 10 years with the advent of immunotherapies and many different targeted therapies. We ran clinical trials here that led to the approval of immunotherapy in combination with chemotherapy. And not only did this more than double the average survival of a patient with metastatic lung cancer, we also started seeing that anywhere from 10 to 30% of patients were actually being cured. There are also clinical trials that we're using in earlier stage cancer, so stage 1 to 3 lung cancer. These are patients where we know that we have a much higher chance of curing them.
We still have a way to go, but it has been great to see the achievements we have made.
I want to thank you for investing in our work. An investment in our program helps us to detect lung cancer earlier and treat it more effectively. It makes a big difference in people's lives.
Everything coming out of our laboratories that is funded in large part by philanthropy is what will lead to the next generation of cancer drugs.
It makes the difference between saving lives and not saving lives. It makes the difference between understanding lung cancer better today than we could have 20 years ago.